Hello and thanks for joining us on the FCT Call Center on ASO Radio and Television Services. Now on FCT Call Center, we bring to you the activities of the Secretariat, the departments and the agencies of the Federal Capital Territory. On today's edition of the FCT Call Center, we'll be looking at a critical sector of the nation's economy, the health sector. And we have from the FCT Hospital Management Board, Dr. Egbe Tabunde. Thanks for joining us on the FCT Call Center and the studios of ASO Radio and Television Services.
Thank you very much, FCT.
You can follow the FCT Call Center. You can watch us live on DSTV channel 392. We're on Star Times TV channel 127. And on Free TV, you can watch us on channel 507. We're also on the UHF band channel 38 and on Arabsat channel 01. I am Holina Adojo. Stay with us. We'll be back after this time out.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we would realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite.
This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television DSTV Channel 392, Star Times Terrestrial Channel 127, Free TV Channel 507, People's TV Channel 285, and UHF Channel 38.
Thank you very much for joining us on the FCT Call Center. Today we have from the FCT Hospital Management Board, Dr. Egbe Tabunde. She's the Deputy Director Medical Service in the FCT Health Management Board. Once again, thank you very much for joining us. Now, please give us the progress that has been recorded in the digitalization process of transferring patients' medical data between the FCT hospitals.
Thank you very much. The Hospital Management Board plays a very crucial role in the secondary healthcare delivery services in FCT. That is either the curative or rehabilitative work. And with the current digitalizing global services health standard, to meet the global health standard of digitalization, FCT had in about 8 of our hospitals, we have some masks have been erected and are ready to commence services. And these services include inter-hospital transfer of patients' data. It means if you are registered in one of our hospitals, either in Asokoro, and you happen to be in Karishi for care, you will not need to re-register yourself in future in Karishi. Your information can be moved from your primary hospital where you have registered to where you are for services. And this had been test run. They've tried to test run in one of our very small hospitals. and the challenges and the hitches they saw are being fine-tuned for proper service delivery. So this idea of mobile manual things is likely to be a thing of part very soon in FCT Health Services.
Okay. Now let's have an update. Give us an update on the introduction of free and compulsory registration of health insurance for vulnerable pregnant women in the 6 area councils of the FCT. How far have you gone with that directive?
The FCT Health had put up the plan to register, insure some vulnerable individuals in the society, and the pregnant women, who can say are pregnant, and the elderly are top on the list of vulnerable persons in our society. So far, FCT Health have registered about 25,000 vulnerable persons as of date. They plan to register about 100,000 in the next 4 years. And this does not include the federal health insurance, which is being run by civil servants that are in FCT. As of today, we have about 175,000 lives registered under FHIS. The national health insurance is not part of this, because this one covers other civil servants that are not FCT staff. So really, FCT is really working hard to help our vulnerable people in the system, and I think we look forward to other people coming out to register, because it will really help and prevent unnecessary death in our society.
Now this is to the area council. What progress has been made so far in the 6 area council through this registration compulsory? This from what we gathered is compulsory for vulnerable pregnant women.
Really, all pregnant women are vulnerable. Let's not make it look like some are not vulnerable. All pregnant women are vulnerable. As of today, about 25,000 lives have been registered under this program, and this includes, like you said, in all our 6 local government
area council.
They are being registered as they arrive. We just keep like use of radio jingles and use of visitation to other hospitals, markets, or even the religious areas, encouraging individuals, pregnant women and vulnerable individuals, to come out and register, because there's a scheme for free medical care for them. We really want to do as much as we can to prevent maternal death, to prevent neonatal death, because this had put Nigeria in a very bad phase in the health services in this country. Thank you.
Okay. Now, overcrowding is a serious problem in most hospitals. Now, what measures has the board put in place to address, to enable patients to book ahead for appointment?
Currently, like you said, we do a lot of manual booking. Individuals had to present themselves or send someone to book themselves to receive medical services. But in the next few months, this will be a thing of the past. A lot of the hospital electronic medical record, the EMR, is being put in place in all our 14 facilities. Our staff that are working in our medical record are being trained to manage this. And once the mass is effective, individuals in FCT will be able to make phone calls from their homes to book their hospital visitation. That way they'll be able to spread out this patient, and people can come in at their own time, having registered with online before coming in. This will really stop overcrowding in our hospital. Like, if you get there between 7 and 8 or 9, you see the crowd in the hospital. But if they've been booked and given time, it will really, really reduce overcrowding. And we know it will happen. It will very, very soon we'll have it in FCT.
But before this, we had a system where people are being booked daily or weekly. Like you have Monday, Tuesdays, Wednesdays, Thursdays, and patients to see their doctors on Thursday clinic, Monday clinic. Is this different from what we already have on ground?
This is different. Because when you book manually, like individuals go to book, and the medical record officers had captured you, they cannot really cut down patients that are coming in. If like emergency cases come in on a Wednesday or on a Thursday, and you have booked like 60 patients in a special clinic. We have some clinics that are special clinics, like we have dermatology clinics, we have the surgical clinic, we have the orthopedic clinics. We cannot just wake up and have like 100 patients. They will not give them their best services. So normally we manually book these patients, like you said, according to their weeks. But with this new mobile booking that will likely take over in FCT, we'll be able to tell if we are going to have 50 or 60 persons coming in on Wednesday. It means the department will make its workforce ready. You will not be taken by surprise that, oh, I'm expecting 40 patients, and you have like your 4 or 5 doctors in your consulting room, only to have like 80 persons. This happens a lot during public holidays or during festivities. But once we have online booking, then we have accurate number of patients that are coming in to see doctors, and the workforce can be moved to effectively manage the day. So overcrowding will not really be happening in FCT hospitals.
Okay, now let's look at the quality of neonatal care services in FCT hospitals. How is it like?
FCT services, like I said, we offer a lot of secondary services now. We've really moved. The neonatal care services have really been improved, upgraded. We're talking of the personnel on ground, have very senior personnel on ground to manage that department. And in the recent past, the facilities like the Hospital Management Board, along with its mother, the Health Secretariat, had upgraded about, I think, 4 of our hospitals now to use of a solar system in the neonatal unit. It means power is not going to be a challenge. We won't have referral in those areas. We are talking of Metama, Asokoro, Nyanya, and Akubwa. Those 4 had enjoyed solar, and others who it will come up in stages. So very soon our 14 hospitals will also have solar in all their neonatal units. They've also been given some modern equipment to help them to work efficiently. They didn't just stop at giving those equipment. The biomedical engineers in our hospitals as well are trained to maintain those equipment, but that is where a lot of problems are. If you have very good equipment and you can't maintain them, then we have challenges. So our neonatal units have really been upgraded to serve the populace of FCT.
Okay. Now, one of the challenge we have experienced lately in the country in the health sector is medical personnel and other health workers complaining about brain drain and the Japa syndrome, the migration, the mass migration of medical doctors and nurses to seek for greener pasture. How has the FCT hospitals managed this situation?
The popular brain drain, or what is called Japa syndrome, had also affected the health system, and FCT health system is not exempted. But with the awareness of what's going on, the board and its mother offices are aware, and they are continuously replacing officers that are leaving. Like where we have maybe nurses, doctors, it's not just doctors and nurses, we have lab scientists, radiologists, a lot of people. As they leave the system, they continuously upgrade and try to replace. Right now, they are working on mass employment, because the last time the permanent secretary visited one of our hospitals, he told us that they actually had compiled some names, and very soon we'll have enough personnel to work so that individual health workers cannot be overstretched as they work. So this will be a continuous thing, because as people keep leaving the country, we'll keep replacing them.
Okay. You're watching and listening to the FCT Call Center on ASO Radio and Television Services. Today on the program we have from the FCT Hospital Management Board, Dr. Igbi Tabunde. She's the Deputy Director, Medical Services in the Health Management Board. Thanks for joining us once again. Stay with us. We'll be back shortly.
Thank you.
The welfare of millions of people for generations to come may be affected by the wisdom which we here display. If Nigerian leaders and our British partners are to prove themselves worthy of their trust, now is the time for us solemnly and truly to dedicate ourselves to seeking the greatest good of the greatest number of our people in Nigeria. Independence for Nigeria in 1960 is imperative. But independence for Nigeria as a corporate entity is not enough. The peoples of Nigeria must at the same time be guaranteed their freedom. We must ensure that in an independent Nigeria, individual citizens throughout the land enjoy liberty, human dignity, and equality under the law. There must be one Nigeria with one constitution and one law for all. Let us therefore, Mr. Chairman, sir, close our ears to the counsel of despair, which says that we cannot here at this conference agree on a constitution. If there's any doubt among us as to what should be written into the constitution, let us, as Democrats that we profess ourselves to be, refer such problems, as the goal has done recently, to the people whom we profess to represent, either just before or at the federal elections late in 1959.
You're watching and listening to the FCT Call Center on ASO Radio and Television Services. Today on the program we have Dr. Egbi Tabunde. She's the Deputy Director, Health Services, the FCT Health Management Board. You can follow the FCT Call Center on ASO Radio and Television Services. You can watch us on DSTV channel 392, on Star Times TV channel 127, and on Free TV channel 547. You can also watch us on the UHF band on channel 38. Listen to us on ASO Radio 93.5 FM. Now, the FCT administration has continuously urged medical practitioners to improve their service delivery. Now, what strategies does the board have in place to achieve this goal?
Hospital Management Board in FCT monitors its officers in so many ways to make sure that service delivery is optimal in our facilities. They install things. We have generally each hospital is we do monitoring services to each hospital quarterly to see how the structures are, so that when patients are in our structures they are comfortable. We also see the availability of working materials and how they are being maintained in the hospitals. The Hospital Management Board also have input a program with the help of the medical records. Monthly activities of every officers in the hospitals is being recorded and sent to board. This way we know that officers, we know the expectations from each department, and if they are working below standard, we would like to know what their challenges are and why it is so. We also receive work services from either the emergency units. If there are challenges in the department, there's what we call a chain report from the compound office that directly can report to the Hospital Management Board. They have a special WhatsApp program. So when we have challenges in either Nyanya, they need to transfer maybe a pregnant woman with a challenge, instead of just moving around in the middle of the night with a pregnant woman, they make calls to the WhatsApp group, and each hospital hooks on and they say, see, there's a bed in Kubwa. It means it's easier to move that patient straight to Kubwa for quick care, because Kubwa will be expecting that bed, and that WhatsApp program has been very, very useful in care of pregnant women, especially the very vulnerable elderly and children. This has really helped, and also monitoring the services of our personnel. This has really helped service delivery in FCT, and we keep fine-tuning and making it better till we achieve the standard that we call it is ideal.
Now, additionally, what plans are being made to ensure that Servicom is accessible and operational in all hospitals in the FCT?
Our 14 hospitals have Servicom activities. We have Servicom desk office in all our 14 hospitals. We have officers that are like, we call them Servicom officers that man each hospital. They are also linked to there's a Servicom officer that oversee all the Servicom activities in our 14 hospitals in the hospital management board. One of her major job is to listen to the challenges in the hospitals. If they need to make a visit, they'll make a visit. And if there are challenges that individuals need to be either disciplined or encouraged, those who are working very hard, because it's not all the time that we are disciplining people. Sometimes they are giving awards that shows how they have performed, those who take their department very seriously. So Servicom is fully active in FCT hospitals, and a lot of our patients can testify when they make complaints how it is handled. Okay.
Now, finally, before we go, what challenges the FCT Hospital Management Board facing?
I think one of the challenges also management board is facing maybe would be FCT itself. It's a very difficult city to live for a lot of people. When you give some people the employment, they look at the expense, how expensive it is to either have accommodation or send their young ones to school. The movement is so difficult for some people that they don't want to come into FCT. We hope that more housing can be put up in certain locations by the federal government. We know things of government houses are things of the past, but we desire that maybe the government should put up some houses in locations near our hospitals so that health workers can either buy those houses or they can rent them, or they can also encourage people to come into FCT. If you live in Lagos and you want to come into Abuja and you are given a job and move to Karishi, and you don't have a house in Kari, you can't get a good house in Karishi, you go and live either in Karu. The transit to work will be a big challenge. You have to bring your child maybe into Garki, Asokoro, who say to go to school. It's a big challenge. So we think if we have more housing available around our hospitals for health workers to reside in, it will help in care. And then we look forward that something will happen that the expensive life of food in FCT can be controlled.
All over the country, yes.
Rent, I think it's not just only health workers, it's everybody. We look that the government will look into it and help individuals to make it better. And we look forward to maybe an intercity transportation. It will also help some of our staffs that live in the periphery and come into town. A lot of them had challenges being moved by very bad individuals when they are transiting between home and offices. We look forward to a better Nigeria, and we are seeing what this government is doing. We're very happy about it. Thank you.
Thank you. That's the size of our package today on the program, the FCT Call Center. Thank you very much, Dr. Igbi Tabundi, for coming onto this edition of the FCT Call Center.
Thank you very much.
Do join us next week for another edition of the program. I am Hulina Adojo. Thank you very much for staying with us.